Hello everyone. In this video, we are going to discuss the important points to be considered during teeth identification for your university practical examination. So, I am going to give you a basic idea on the differences between primary and permanent dentition that will assist you in teeth identification. So, here we have the permanent and the primary typhodont models using which we are going to discuss the differences between primary and permanent dentition. Firstly, we are going to see the differences between primary and permanent central and lateral incisors. When it comes to the primary, central and lateral incisors, as you can see, they are smaller in overall dimensions and the mesiodistal width of the central incisors and the lateral incisors is generally greater than their cervico-incisal length. I repeat, the mesiodistal width is greater than their cervico-incisal length. They are wider mesiodistally. Okay. Now, when it comes to the permanent dentition, as you can see, the permanent central and lateral incisors are generally larger in dimensions when compared to that of primary teeth, and also when you check for the dimensions, the permanent incisors have a greater cervico-incisal length when compared to that of their mesiodistal width. Whereas it was the inverse in case of primary dentition. Here, the cervico-incisal length is greater than the mesiodistal width. So, these are two important differences between the primary and the permanent central and lateral incisors. Another important feature that you see in permanent central and lateral incisors is the presence of mamelons. Mamelons are nothing but the rounded protuberances that you see on the incisal edges or on the cutting edges of the permanent central and laterals. So, if mamelons are present, you can confirm them as permanent central and lateral incisors. So, to summarize, you check for three important features among primary and permanent central and lateral incisors, that is the overall dimensions. The next one is the mesiodistal and the cervico-incisal length, and the last one is the presence of mamelons to confirm them as permanent central incisors and lateral incisors. Next is we are going to see the differences between the primary and the permanent canine. So, now when it comes to the primary canine, as you can see, the primary canine is generally small in overall dimensions, and when it comes to the cuspal tip, it has a very blunt cuspal tip, and also the mesiodistal width is greater. Whereas when it comes to the permanent canine, as you can see, the permanent canine has a sharp cusp tip when compared to that of primary canine. Also, it is larger in dimensions than that of primary canine, and most importantly, you can see that the cervico-incisal length is generally greater than that of the mesiodistal width in the permanent canine. Also, the mesial and the distal slopes are more prominent in case of permanent canine. Another important feature that you look for canine differentiation is that in case of primary canine, in the natural dentition, you can check for attrition or wear facets in the cuspal tip of primary canine. Here in typhodont model, you cannot visualize that, whereas in the natural dentition, in case of primary canine, you can visualize the attrition or the wear facets which will be shining on the cuspal tip of primary canine. That is an important confirmatory feature for primary canine. So, to summarize, to understand the differences between primary and the permanent canine, you can check for the overall dimensions of the tooth. You can check for the cuspal tip and the cervico-incisal length and the mesiodistal length in both primary and permanent canine. You can check for the mesial and the distal slope prominence in permanent dentition. And finally, the most important feature is that you check for the attrition or wear facets which will be present on the cuspal tip of primary canine. So, coming to the last part, we are going to see the differences between the primary molars and the permanent premolars. Now, as you can see in the primary dentition, the primary molars have a wider mesiodistal width, whereas in the permanent premolars, the mesiodistal width is less when compared to that of primary molars. So, this mesiodistal width is definitely greater than the mesiodistal width of the premolars. So, this is a very important distinguishing feature, and also when you check for the cuspal morphology in primary molars, you have distinguished 4 cusps in primary molars, whereas in permanent premolars you have a distinguished and buccal and palatal cusps alone, which are very sharp and prominent. So you have only 2 cusps in the premolars which will be very sharp and prominent. So based on the mesodistal width between 2, differences between 2 and the cuspal morphology, you will be able to differentiate between primary molars and permanent premolars. If you are confused in the identification between a primary molar and a premolar, because there is a decay in a tooth, you see a proximal decay in a tooth. In that case, you can give the identification as a primary molar, because a newly erected premolar cannot undergo such a devastating decay in the proximal side soon after the period of eruption in a short span of time, because you all know that dental caries is a chronic irreversible disease which occurs over a period of time. So in case if you see such a proximal caries and you are confused between primary molar and premolar, you can give the identification as primary molar, because only a primary molar can undergo such a decay over a period of time. So that is one important feature for identification between primary molar and premolar here. To summarize, you check for the mesodistal dimension between the primary molar and the premolar. You check for the cuspal morphology between both, and more importantly, if you see any decay in the proximal side, you can give the identification as primary molar. So now we have come to the end of the video. So apart from these differences between primary and permanent teeth, it is of utmost importance that you know the chronology of primary and permanent dentition. So only if you know the chronology or the time of eruption of the primary and permanent teeth, you will be able to correlate it with these differences and give the correct teeth identification in your examination. So make sure you are able to memorize the chronology correctly and then correlate it with the clinical findings in the patient's mouth and give the teeth identification in your university practical examination. Thank you.